When I have an idea for a video, I like to check what other videos are already out there on the topic to make sure I'm not repeating the same information as everyone else. So this week I went onto YouTube with a beginner's mind and searched, "What is dialectical behavior therapy?" Here are a few comments from one of the top results. A video by Psych Hub that has 213,000 views. The video is literally called, "What is dialectical behavior therapy?" You didn't even explain what it is, LMAO. But what does it consist of? This is the second video I've watched and I still have no clue what DBT actually is. This video explained nothing to me. What is DBT? I'm hoping these commenters and anyone else seeking information will find this video a little more helpful. This is still just an introduction, so I'm not going to get too deep into DBT, but I will explain what DBT is, how it differs from traditional therapy, what DBT skills are, what a DBT program looks like, and whether or not you can learn DBT on your own. My name's Sarah, and I've been in remission from borderline personality disorder for almost 2 years. Nope, for over 2 years. I'm not a mental health professional like the creators over at Psych Hub, but I have used many sources to collect information about DBT that I've boiled down into the essentials for this video. So the question of the day, what is DBT? Dialectical Behavior Therapy, or DBT, is a form of psychotherapy that was developed by Dr. Marsha Linehan. It has become the gold standard for BPD treatment, and it's been found effective for many other conditions, especially related to issues with emotion regulation or impulse control. A little background is needed to properly explain what DBT is. Dr. Marsha Linehan is a research and clinical psychologist whose main focus from the beginning of her career was on highly suicidal people. In 2011, she opened up publicly for the first time about her own history as a highly suicidal person. She's fascinating and inspiring, and I'm going to talk about Dr. Linehan much more in future videos. But in the late 70s, she was working with these highly suicidal and self-harming patients and found that the standard treatment, cognitive behavior therapy, or CBT, wasn't effective on them. CBT is still the most common form of talk therapy for depression, anxiety, and many other mental health conditions. In CBT, the aim is to understand and change your negative thought patterns. The idea is that if you change your negative thoughts, then you change your negative emotions and your negative behaviors. The patients Dr. Linehan was working with were mostly BPD patients, and borderline personality disorder comes with very intense emotions. I feel comfortable speaking on behalf of the borderline community when I say that none of us want to feel these painful emotions or have such extreme reactions to them. We already think we shouldn't be the way we are, and we often hate ourselves for it and feel a lot of shame, which just worsens those emotions and behaviors. So having a therapist who doesn't seem to understand what we're experiencing, essentially tell us that it's all our fault, is upsetting. The emphasis on change in CBT can lead to anger, self-loathing, and hopelessness. Dr. Linehan wasn't making progress with her patients by only focusing on their need to change, and maybe it was because of her own background, but she recognized the reality of her patients' suffering and their need for validation. So she tried focusing on acceptance instead. She tried just listening and validating, but that wasn't effective either, because her patients did want help. I've had plenty of therapy sessions with doctors who just sat and nodded their heads while I needed actual guidance towards change, and it's incredibly frustrating and not helpful. It's discouraging. And so, Dr. Linehan developed dialectical behavior therapy, which is sort of like a modified form of CBT that focuses on balancing change and acceptance. Dialectical means two seemingly opposite ideas existing together. Instead of black or white thinking, it's black and white thinking. The core dialectic of DBT is that you can accept yourself and your behaviors while working towards changing them. You're doing the best you can, and you can also do better. But DBT doesn't just vaguely encourage acceptance or show you what you need to change. A big part of what makes DBT so effective is its use of DBT skills. DBT skills are a set of practical tools that instruct how to accept the problems we have and how to change them. DBT skills are broken down into 4 categories. The first 2 are acceptance skills. These include mindfulness skills, which help reduce pain and improve mood, and distress tolerance skills. which teach you how to tolerate stressful situations so you can find an effective solution to whatever's causing your stress. The other two categories are the change skills. These include emotion regulation skills, which teach you how to control your emotions so you don't react to them impulsively, and interpersonal effectiveness skills, which help you be more effective in relationships with others. These skills are usually taught by a certified instructor in a group setting during weekly sessions that usually range from 1.5 to 2.5 hours. These sessions aren't like regular group therapy, they're more like taking a class. Everyone has different problems, and our own problems are always subject to change without notice, so it's important to learn and practice all the DBT skills. Then you already have them ready to use if and when you ever need to. It usually takes 24 weeks to get through the full skills curriculum, so most programs have at least a 6-month commitment, but many run the curriculum twice, making it a full year, since it takes a lot of time and repeated practice to really make these skills stick. Neuroplasticity. DBT programs vary in structure. They all focus on these concepts and skills, but Dr. Linehan's standard DBT program, also known as comprehensive DBT, has 4 components that make it uniquely effective, especially for very severe cases. Of course, there are the weekly skills groups, but then there are also hour-long individual therapy sessions with an assigned therapist from the same DBT program. If you already have a regular therapist, you can't work with them while you're in one of these standard programs. There are modified programs that allow that, but I'll mention those later. In the standard program, a DBT certified therapist will work with you on your specific problems and help you work towards treatment goals. They will also supplement the skills training, but on a more individual level. Every week you fill out a diary card that tracks emotions, behaviors, and your success in using different skills, and then you bring that in for discussion during your individual sessions. Standard DBT also includes inter-session contact, or phone coaching, where you can access your DBT therapist outside of sessions if a crisis arises and you need help effectively navigating a situation in real time. These aren't therapy sessions or long calls, and there are a lot of boundaries the therapist has to put in place for these coaching sessions, but they can be really helpful for reinforcing DBT skills when they're needed most, which is when it's usually hardest to remember how to use them. And finally, standard DBT also includes a DBT therapist consultation team, which is essentially therapy and support for the therapists themselves. This prevents burnout and increases motivation and effectiveness in treatment. Obviously, patients aren't involved in that component, but it still lends to the unique efficacy of DBT in BPD treatment, so I think it's important to note. Standard DBT is a fantastic concept and has shown to be highly effective. But because it's so involved, it's not accessible, affordable, or otherwise feasible for many people. Well, that's not good. Stuff is like falling down all around. Do I have ghosts? If you do have a severe case of BPD and you've tried other treatment routes that haven't helped, it's definitely worth getting on a wait list or figuring out if you can start a program if possible. But if you can't, or your symptoms aren't as severe, there are many modified skills group programs, so there may be other available options that could meet your needs. Even if you're not interested in a full skills curriculum, there are some non-certified therapists who are still comfortable and familiar enough with DBT to implement some skills and concepts in regular therapy. If that's something you're interested in, you just need to do research on your options and call around and ask lots of questions. It's much easier to do so effectively when you have information at hand, so I hope that this video has been helpful. More helpful than Psych Hub, at least. There are also resources to help you learn DBT skills on your own. I can't say if that's a smart path for you specifically if you have other options. There are those other elements of DBT programs that you obviously miss out on if you choose to only learn on your own. It also takes a lot of effort and practice to learn how to effectively use these skills yourself. It's like learning anything on your own. It's a lot of work. But if you're committed and realistically feel like you're capable of it, I'm going to say you probably are. At the very least, these resources can be a great way to get more familiar with the concepts in general, which can be helpful for a lot of people even without BPD. DBT skills are really just life skills. Not all of them will apply to you, but some will, and you never know when you'll be faced with new problems and require new skills. I guess now's a good time to disclose that I've never done DBT. Whoops. I actually did one DBT skills session as a condition of my inpatient discharge in 2013, but that's a story for a whole nother day. By the time I was correctly diagnosed with BPD in 2020, I had already figured out a lot for myself on my own, and starting a formal DBT program didn't make sense for me at the time. But if I knew about it sooner, it definitely would have been a recovery shortcut for me. I realized a lot of the work I had done was basically reinventing the wheel once I went back and started learning about DBT. So I do believe in DBT, I do recommend it, and I do still learn it for funsies. If you are interested in DBT or BPD Self Help, next week I'm going to be reviewing some different workbooks I've been using and comparing. And I'll have another video reviewing flashcard decks after that. So please subscribe if you're interested in those videos or any of my other content. If you're still here, you must like me a little, and I like you too. I hope to see you in the next one. Peace. DBT, BPD, DBT, BPD. DBT, BPD, DBT, BPD, DBT, BPD, DBT, BPD, DBT, DBT.